The conventional diabetes care has transformed into new diabetes care. So we have two innovative molecules, SGLT2 inhibitors and GLP-1.
These two molecules clearly have changed the way people live with diabetes. We have moved away from the conventional glucose-centric approach of a metformin or a sulfonylurea and a glitazone or a AGI to actually these cutting-edge modern agents.
So what is this cardiorenal metabolic continuum and how these new drugs have changed the management of diabetes?
So today there is a whole continuum of care, and in that we have moved from the so-called downstream approach to an upstream approach where we give equal weightage for four parts. One is of course weight, second is cardio-renal outcomes, which is CV outcome and renal outcomes, and then is cardiovascular risk reduction. So glucose is just one of those four tenets in the entire continuum. So I think these drugs are game changers, and I think these drugs initially were losing weight up to 5%, then they moved to 10%, and now we are getting agents which will be competing with bariatric surgeons. I think bariatric surgeons may be out of business in another decade and a half if these agents show that they have proven safety and efficacy and they are affordable and accessible.
So that is again very good news. That adipose-centric approach has come in forefront even ahead of the glucocentric approach because obesity is a driver of cardiovascular disease on one end and a driver of diabetes on the other hand.
To lose weight, you can reverse diseases. So I think weight is the center point of the fulcrum which is driving diabetes type 2 and lot of other diseases. And we are thin fat Indians. So even at a lower BMI, we have extra fat in our body. There is a complete revolution in the management of weight and diabetes, and therefore this whole term is called diabesity.
We have lifestyle modification, then pharmacotherapy now. Artificial intelligence is coming in a big way.
Artificial intelligence is going to be the window to recognize the habits of human health, and it will help us to map